Today I'm going to talk about the best exercises for low back pain. And I'm going to put this into two groups and make this fairly simple. Hi, I'm Dr. Paul Lieber from Regenexx Pittsburgh. For people who have spinal stenosis, narrowing of their spinal canal, and as a result have nerve pain or weakness in their legs because of narrowing of their spinal canal. These are people who are intolerant of arching backwards. When they arch backwards, they compromise their spinal canal, and therefore they become symptomatic. So for these folks, exercises where you're bending forward are the best. These are the people who they can walk for a mile when they're bent over pushing their shopping cart because they're opening their spinal canal. And so for them, actually exercising and pushing the shopping cart is a good thing because they're strengthening their legs, they're getting conditioning, but they're not compromising their spinal nerves. Other exercises for spinal stenotics, and again, these are the folks that are intolerant of arching backwards, are exercises where you bend forward. So we talked about, and I will talk again about bringing your knee, single knee to chest and holding it for 60 seconds and repeating it once. Double knee to chest, holding it for 60 seconds and repeating it once. And passive straight leg raise where you're putting a jump rope or a strap under the arch of your foot and lifting your leg with your arms, not lifting your leg with your leg, and holding it up there with your knees straight for 60 seconds to tolerance. You want to bring it up to the extent that you can tolerate it. You don't want to go more or less. You'll feel that stretch in your leg as a result. Hold it for 60 seconds and repeat it. But additionally, things like abdominal crunches are exercises that spinal stenotics can do to strengthen their abdominal musculature. So those are some exercises. In addition, there is an exercise where you can use a fit ball, which is that big exercise ball. You can put it in a corner, lock your legs in the corner, put the ball basically under your abdomen and chest, hold your arms behind your neck, and gently arch to what's called neutral spine. In other words, you want to be straight out. You don't want to go into extension. You don't want to arch backwards, but you can roll over the ball and go to neutral spine and strengthen those paraspinal muscles. These are the 4 exercises that I would recommend for a spinal stenotic who has pain with extension and often will have nerve pain or weakness in their legs with prolonged upright walking. Additionally, riding a bicycle where you're bent over forward is an exercise that a spinal stenotic can do because you're opening the spinal canal and opening the neuroforamen where the nerves come out to the side. So spinal stenotics can tolerate riding a bicycle where you're bent forward. And some spinal stenotics even tolerate those turn down racing handlebars on a 10-speed because their spinal canal is maximally opened. So that's what is good for those folks.